All right, thank you, Matt. Well, tonight, only on NBC5 News, we're continuing our look behind the curtain at Medford Police Headquarters with how law enforcement deals with mental health, both on duty and off the clock. It's part of our Suicide Prevention and Mental Health Awareness Initiative, Tomorrow Needs You. NBC5's Craig Smolin has a story.
Many of us work jobs that lead to high levels of stress. But for the brave men and women who keep our communities safe, turning things off when you get home isn't simple or easy. It takes work, and an understanding support system can make all the difference. Detective Diane Sandler spent more than 19 years investigating some of Medford's most sickening crimes, child abuse and maltreatment cases. The work isn't for everyone.
A lot of patrol officers say, they couldn't do that job.
To this day, she can vividly recall some of the tougher crime scenes she came across, even early in her career in Milwaukee, Wisconsin, more than 3 decades ago.
There are times when I close my eyes that smell still comes to me. And the sight of that particular scene is just ingrained. And that was not something that I wanted to go home and talk about with anyone.
Another one that made a personal mark was a Medford murder-suicide. Detective Sandler wasn't the lead detective. She was brought in to interview the victim's young daughter and to tell her that her mother was gone.
At the time, my daughter was 9 years old. I had just learned that this child was 9. And at the threshold of that door, walking into the front room, it just hit me that I'm going to be changing this child's life forever. That was a tough day. That was a tough day. I finished my shift, and when I went home, I just held my kids. So I have a great relationship I have 2 daughters. I have a great relationship with both of them. And they both allowed me to hug them and hold them, not asking questions or not knowing what I had seen or been through, but knew that I must have had a day.
She says managing her mental health was a juggling act and admits she often put herself last.
I was very fortunate and blessed that I have a really solid support system. I have a great marriage. My children didn't really give me grief. They're good kids, smart kids, and it was a joy to be very involved in their lives. But there was absolutely times where trying to be the best detective that I could be, the best wife I could be, the best mommy that I could be, that creates a lot of stress.
Sandler found balance. She volunteered at her daughter's schools whenever possible, got plenty of exercise for both her body and her mind, and was transparent about the challenges of her job with her husband without sharing traumatic events. She also spoke with her pastor and, at times, a professional.
Officers need an outlet. They need a healthy outlet. And they also need to know that they can talk to somebody that's qualified, experienced, and somebody that they can trust. Because police officers notoriously don't trust people, right? They don't want to share their secrets. They don't trust.
Sandler believes every officer handles their mental health differently, but she says Medford Police as an organization does a great job in making the conversation around mental health a daily one.
I think for far too many years in law enforcement, officers were made to feel like they couldn't be vulnerable and they couldn't share. And I'm glad that that's changing. So, and I hope that people see that and realize that we're just like you, just like you.
Coming up in the conclusion of this exclusive 3-part series, we're learning how Medford Police leadership are trying to normalize the conversations around mental health and what programs the region's largest law enforcement agency has to help their officers and their families. That's Thursday night, right here on NBC5 News. Remember, if you or someone you know is going through a mental health crisis, you can call or text the National Suicide and Prevention Lifeline 988, 24 hours a day, 7 days a week. In Medford, Craig Smullen, NBC5 News.